Welcome to Smart PT. My name is Jonathan Reimer. This week I want to talk about anterior talus. It's a common issue that occurs following ankle sprain, but does occur for other reasons as well. Potentially a tight calf muscle over a number of years might also produce this dysfunction. But basically what an anterior talus is a forward shifted position of the talus relative to the tibia and fibula, the mortise that it forms. What the problem is that you cannot get proper posterior glide of the talus on the tibia and fibula. So there's sometimes an impingement type situation happening at the front of the joint line. So that's typically what people will come in complaining of. They'll complain of pain across the front of the joint, similar or sometimes mimicking what you would see with ankle sprain type pain. It's very commonly following, as I said, an lateral ankle sprain. So you'll see sometimes more impingement at the anterior lateral aspect, and that's basically because the ATFL, the anterior talofibular ligament, is often sprained, and it's allowing that corner of the talus to slip forward a little bit more into an anterior lateral rotary instability type of issue. So people, as I said, will have trouble getting the talus to shift posteriorly, which accompanies dorsiflexion. With dorsiflexion restriction, there's generally difficulty with things like squatting, descending stairs, anything that forces kind of people towards end range dorsiflexion. So those are going to be the kind of things that you'll see. Objectively, you can do a test like a single leg squat type test and see if the people have a sensation of reproduction of impingement across the anterior ankle. So that type of test wouldn't necessarily stress a ligament like the ATFL. Some people may get calf tension, but that's not the issue we're looking for. What we're looking for is that sign of impingement with that type of movement, and you can compare side to side. Of course, then you're going to take a look at mobility. You're going to check your posterior glides at the ankle, and you'll sometimes feel a hard capsular or hard bony type of end feel when you're trying to do posterior glide into dorsiflexion. So you can mobilize that certainly in the same direction and do a lot of stretching. If the problem's been there for a while, you may have to do a lot of calf stretching and calf releases. The issue that occurs if you don't address it is not only is there ankle pain, but there's also a lot of increased stress through the forefoot. So I see it as a possible cause for things like plantar fasciitis, turf toe hyperextension of the first digit at the MTP joint, tibialis posterior, other arch issues. Basically because you lock up that ankle dorsiflexion too early in the stride, and then that forward momentum has to force the stresses through the forefoot. So it's definitely an important thing to take a look at and address. It's one of the most common places that I start when I'm dealing with foot and ankle issues. If you want to learn how to manipulate something like an anterior talus, it's very successful and easy manipulation. I teach these kinds of things in my extremities course, so check us out at smartpt.ca.